What are your top priorities for revamping our county health department so that it is more responsive to community environmental justice needs? Candidate Innamorato, please.
Great. Well, good morning, everyone, or I guess good afternoon. How are we doing? So I'm State Representative Sarah Innamorato, and one of the top priorities that I want to take on as your next county executive is really designing a Department of Health that will center public health provisions and that really centers the needs of the people who are here in our region, because you all deserve a health department that centers public health, that addresses climate change, and undergirds equity in all the decisions that the health department makes. So part of that is really looking at who is appointed to the Board of Health and making sure that that is representative of those priorities. So ensuring that we have folks who are appointed to the Board of Health that have public health experience, that are climate scientists, and what I would say most importantly is folks from environmental justice communities who have lived experience. Because that is a wisdom that isn't always acknowledged in our public sector. You know, growing up here and losing my dad to opioids, losing my home because of that and our family stability, I know that that's informed my decision making and what I've chose to prioritize as an elected official.
Susie.
And I know that that wisdom is extremely valuable in setting the priorities for the Department of Public Health, and that voice is critical when it comes to what our priorities are going to be. In order to build a strong Department of Health, we're going to have to look internal and make sure that we are designing a department that recruits the best people. So we have to look at raising our salaries, we have to look at instituting best practices on retention of these employees and making sure that we're incorporating trainings around IDEA and equity, and making sure that filters into our permit process as well as all of our employee training. And we have to improve our communication between the communities and the health department. And that's going to require hiring someone to lead our health department who cares about addressing climate change, who cares about addressing public health, and is justice-minded. That process is going to have to be in collaboration with the community. So we are going, as county executive, make sure that we have a robust search process that includes the voices of impacted community members in environmental justice communities, so that we can get the leadership we need who are going to care for the things that we all care about and ensure that they are leading us into a more healthy future.
Thank you, Candidate Innamorato. Appreciate that. Okay, so Candidate Fawcett, your response.
Yeah, thank you. Before I answer that question, I just want to thank all of you for being out here, and especially everyone who's all involved in nonprofits. You do really invaluable work, super important. I've been involved in nonprofits myself throughout my whole career, maybe in a little different space, but I've worked with the Juvenile Law Project out of Philadelphia that they work on juvenile justice issues. I've worked with the ACLU, bringing suits against the county relative to treatment of inmates in the jail, and worked with the Pennsylvania Innocence Project, all in the criminal justice space. And also, for years, I was on River Life Task Force, and so took a big interest in sort of environmental issues and land use issues that really impact all of us. The question here is really, what can we do? What can we do, and what would I do as county executive to make the health department more responsive to community environmental justice needs? Now, this is a complicated issue. Thank you for asking the first question. It's a difficult one, but if you know the health department, and even if you go on their website, you'll see the health department has enormous responsibilities, and they're all over the board on everything. They run an immunization clinic, pediatric dentistry, public health clinic that deals with HIV and STDs, and pulmonary center, women's, infant, and children's program, food safety, and so on. One thing after another, housing and air quality monitoring, and so on. To make the health department more responsive, I think we need to actually have them focus on health, principally, health services, health monitoring, and so on. But really, some of our really biggest questions and issues that we have in this county, I think are more or less legal matters. And one of the first things I would do is create a DEE, a Department of Environmental Enforcement. Take these issues of enforcement out of the hands of the health department. So for example, with air quality in the Mon Valley, and relative to groundwater issues and contamination and so on, we need a distinct department with lawyers that are going to enforce the law. We have the law on the books. And I don't think we should have the health department really staffed and run by a board of doctors largely in that space. Let them do the monitoring, let them do the health work that they have a specialty in, and let's have a separate DEE that really takes on the corporate polluters and takes on these issues and is well equipped to do that. So I think that's one thing you could do that actually would make the health department more responsive and more effective.